Patients often ask me, when should I start symptomatic medications for slowness, stiffness, and tremor in Parkinson's disease? A lot of individuals have the idea that the medications will last for a certain number of years, perhaps 5 years, and they think that, okay, I want to save it for when I really need it. Unfortunately, it doesn't really work that way. To the best of our knowledge, it's the progression of the disease that causes the medications to appear less effective as we look further out in time. There's debate among experts as to when the exact time to start medication might be early on. There is what I would call a minority of experts who would say, well, I think we should begin dopamine type medication as soon as we can make the diagnosis to normalize the dopamine concentration in the brain. That's a theory that really is dependent on the idea of just normalizing that concentration because that's the way it normally is. There's really no data to show that that improves long-term outcome or is the better way to do it. On the other hand, we do know that for people who develop dyskinesia, that twisting, turning that appears as a sensitivity, especially to levodopa, that occurs especially in young people. Its appearance does depend on how high a dose a person's on and how early one starts levodopa. So in young individuals, I do like to use the other medications first before levodopa, and then it's important that we not use more levodopa than is necessary to control the symptoms. So here then would be a reason to push levodopa back a little, but we also don't want patients to have slowness, stiffness, tremor, and have trouble in their everyday lives when we have medications that can easily help them. So as far as starting therapy, I take sort of a middle-of-the-road approach. If a person just has very minimal symptoms, let's say a little tiny bit of tremor that's not bothering them, I'll say, okay, I don't think we need to start medication now, but we'll keep an eye on it. And if they come back 3 or 4 months later and they say, okay, now I've got some slowness in my hand that's causing difficulty with writing, difficulty with buttoning, now that they have some functional difficulty, something that's either causing a problem doing an activity or they're uncomfortable because of those signs, then I'll say now's the time to start medication. Let's try to get that improved and go from there. But again, I'll try to keep the doses low and not use more medication than is required.